Although we've started to look at quality outside of hospitals, for example, in primary care, I think you'll see a focus more broadly on home care, community care, primary care, and hospital care, and looking at that in an integrated way, using both cancer and chronic kidney disease as models by which we can develop and implement those approaches. And we're going to have to work towards how we use the levers that we have in the most effective way to do that, including things like the funding lever, because all of our funding for services essentially follows that institutional governance model. So we'll have contracts with hospitals for services, contracts with other providers for services, and we can hold those organizations accountable for their parts that they play in that journey of care, if you like, that the patients cross. But we have to be able to link that accountability so that the patients experience that across the organizations in terms of driving, if you like, a joint accountability for quality for that patient across organizational settings. And so we're looking at how we can best use our funding lever and our quality improvement levers to drive harder on the integration of care. So that's some of the direction that's going to be important for the future. We have a stronger focus on measuring quality more now from the patient perspective. Understanding what quality means to patients. So getting beyond the technical quality of care, which is always going to be very important, and we're always going to have to measure the safety and quality and technical quality of care in our system. But we're moving more to measurement around what's important to patients and families, more around the integration of care, quality of life, these aspects, and being able to measure those and drive quality improvement in the system. So it implies a much greater partnership with patients and families and the public in what those priorities are. And so just an example of that in our most recent Ontario Cancer Plan, which we're going to launch next week, it was co-chaired by a patient from our Patient and Family Advisory Committee. So we implicated patients in all of our work to really drive what those priorities should be.